For many years there's been a lot of talk about coming together as a group of professionals so that we can actually exchange information. We have not had anything like this before at a local or regional level, so it's really nice for people to be able to come together now and actually meet with like-minded folk from all disciplines to look at treating tongue and lip tie in a methodical and evidence-based fashion. It's also really nice to have the opportunity to exchange ideas around where we might take this, to look at our practices and to look at how individual pockets of Australasia are managing to promote health for this group of people, whether they be infants, toddlers, adolescents, or even adults and indeed geriatric populations. There is certainly a lot to be said about a coming together of minds, and I find it really thrilling and exciting to be involved in the beginning of that. There are many professional groups who might benefit from attending our symposium, and I guess that's something you can see by looking at the program and the amount of variation in professional groups that the speakers arise from. So we have everything from paediatricians to speech pathologists to dietitians. It's certainly a real mixed bag, and I think that anyone who works with a population, whether they be babies, toddlers, children, school-aged children, adolescents, adults, more mature adults, I think if you work with people who have swallowing problems, who have dietetic problems, who have postural problems, dental problems, problems with airway development, problems with speech and eating and drinking, anything that you would expect to see with a tongue tie, if you're working with anybody from birth to death who might experience these issues, then this is the place for you to come to gain some more information about this etiology. I'd love to see people expand their mind a little bit about tongue tie and move past the traditional view that a tongue tie realistically only affects breastfeeding infants, to grasp the depth and complexity that leaving one of these things intact can have in a person. We know that breastfeeding infants don't always have an unsuccessful breastfeeding relationship with a tongue tie in place. So we need to be able to help people to look at an individual on a merit basis, to look at their function, to look at their structure, and to be able to bring together the whole picture for this person, whatever age or stage they're at, to look at treating this person and their ties on a holistic level. I'm really excited to introduce to our delegates the remarkable Dr. David Todd, who is a paediatrician working in Canberra. Dr. Todd has a 34-year history of working in neonatology in both research and medicine. At the moment he is practicing out of a private practice in Canberra, working with breastfeeding infants and their mums who have difficulty with relation to tongue tie. Dr. Todd has been involved in some of the key research papers around tongue tie that have come out of our region in the last few years, and I'm really honoured to have him talking to us at our symposium about the current state of affairs as he sees it, and certainly his take on assessing posterior tongue ties. So I think we're very lucky to have Dr. Todd come and speak to us. A lot of practitioners tell me that they feel quite isolated when they are talking about tongue tie in their local community at times, and maybe it's just me, but I can't imagine a better place to be than standing in a room full of people who really want to talk about tongue ties. So yeah, I'm just strange. But I'm sure that a lot of people considering attending our symposium will feel the same way. For me, coming along to the dinner is going to be a real highlight. I think everybody is sitting around and engaging on a social level. You'll have access to our keynote speakers, you'll have access to a wide range of other professionals who are working in the area that you are interested in, and it'll give you the opportunity, a very unique opportunity that has never existed in Australasia before, to actually meet face to face and develop a network for multidisciplinary support for you for when you go back home. Now, I think that's absolutely priceless, and I'm really looking forward to being involved in that aspect of our symposium.